our team wants to provide some resources and support as you go back to the huge task of helping our students and helping our community rebuild. And so on this particular part of our recovery plan, we wanted to talk a little bit about some common reactions and responses that you may see in your students after they've experienced a trauma such as Hurricane Ian. And so first thing that we want to do before we can launch into our students and their behavior, I want you to know that you matter first. We all, adults included, have experienced something quite traumatic, and we have to take care of ourselves first before we can help and support others. And so please take a moment to check in with yourself and see how you are doing. Remember that as adults, we can't pour from an empty vessel, right? In order to pour into our students, we have to be full ourselves. And so I would really encourage you to navigate your own emotions in the midst of this. Please check in and make sure that you're feeling safe physically and emotionally so that you can help others in a way that's sustainable. I would encourage you, if you are not feeling in a place where you are safe physically or emotionally, I would really encourage you to seek professional help or personal help from people that you trust, that you can confide in, from other staff members who can help you in the classroom. Please reach out for help. And if we can be of an assistance in any way, please do not hesitate. If you're struggling with any sort of post-traumatic symptoms or personal difficulties, it's going to be really challenging for you to be able to intervene with your students. And so please, we know how vital it is that we take care of ourselves first so that then we can support our students. So please know that you matter, that your safety is absolutely paramount. And if you are not feeling in a space where you are, please know that help is available. So some common reactions and responses that you might notice from students. Some children may have some increased fears or worries about separating from family members. For some of our younger children, we might notice that they might be more clingy to their parents, to their siblings, or even to you as teachers. So keeping in mind that those might be some common responses. And, as we're talking about common responses and reactions in children, these are not just the children that are within the walls of your classroom. These are your children at home. These are children in the community. We really want to be mindful of these reactions and responses in all of our children so that we can help our community continue to heal. So we may see feelings of anxiety, fear, worry about safety, about others. For some students, it might be concern about safety about their pets, especially if they're having to leave them at home. They may have a prolonged focus on the hurricane, and we may see some increase of physical complaints, upset stomachs, headaches. Some children may express anxiety over future hurricanes. They may be overly sensitive to sounds or other stimulations in the environment. We sometimes may see a lack of interest in their usual activities. And for some students, there may be a sense of loss or grief around what has happened. Sometimes we commonly see our children feeling as if they're like in a daze, that they're not experiencing reality. We may see changes in their appetite, in their sleep patterns, changes in their school performance. We might note some decreased attendance or truancy, especially in our older children. And our adolescents may also engage in some high-risk behaviors as well. Sometimes we do see that post-traumatic events. So a couple things to note. Definitely be alert to the behavior of students, especially adolescents who might be acting out. But then also on the flip side, there are those quiet students who may be struggling more internally. A lot of times we're very quick to note the students who are more hyperactive or aggressive because of the behaviors that we're really seeing. But sometimes the students who are really struggling are the quiet ones. who aren't necessarily saying anything. They can sometimes fly under the radar and not get help that they need because they are quiet. So please be mindful of that as well. You may see some symptoms of avoidance and depression that are just as serious as those of the student who's acting out. So being mindful of the quiet students as well and making sure to check in with them. So some changes in behavior that you might see. Again, we've talked about increased hyperactivity and activity level. They may have difficulty concentrating and sustaining attention. You may see elevated irritability towards you as an educator, with their friends, or they may withdraw from others and activities that they enjoy. For some of our students, we may see angry outbursts. We may see hyperarousal, where they're very easily startled or extra sensitive to sounds, to noises, especially things that are startling. We may see increased aggression, both verbal and physical. And especially in younger children, sometimes we do see regressive behavior. So some of those behaviors that we saw when they were younger, they may regress to some of those behaviors as a result of these traumatic events. So what do we do, right? So for the most part, most of our students, with the support that we're providing them, they are going to be able to recover without prolonged signs of distress. However, for some of our students, they may have reactions that continue or worsen after 2 weeks or more. So really, if we're seeing these behaviors 2 to 4 weeks after returning to school, that's when maybe we need to refer a student. So how do we recognize our at-risk students? And then what do we do? How do we refer? So students who are really exhibiting significant changes in behavior for an extended period of time. So again, that we're seeing those behaviors continue, or they may even worsen beyond 2 to 4 weeks after returning to school. Those are going to be the students that we want to refer for additional support. If their behavior, their disruptive behavior, really impacts their functioning at home or school or across multiple settings, that's when, again, we're going to want to refer them for additional support. If their behaviors are severe, if they're frequent, if they pose a threat to themselves or others, absolutely, we need to refer them for additional support. And who do we refer to? I would suggest that really your first point of contact be the school counselor at your school. They will have resources for you. They will help to navigate the process of within school referral. And if further assistance is needed, that the school counselor is going to be able to access those resources in the community or in the school. We also really encourage that the family stay connected, that we really keep that open line of communication with parents as to how their children are responding while they're back at school, any behaviors of concern that continue past that 2 to 4 week mark, or elevated behaviors of concern. We want to make sure we're communicating that with the family as well. I would say when in doubt, refer. If you're concerned at all, talk with your school counselor, talk with the professionals on your campus. We would rather you be proactive and not reactive, because we know early intervention is so beneficial and provides better outcomes for our students and decreases the likelihood of trauma-induced mental health issues and challenges later on. So when in doubt, please refer any behaviors of concern so that we can provide support to students and earlier rather than later on. Again, as we talked about at the beginning, you and your mental health and your physical safety and personal well-being is absolutely crucial. So please, if at any time you are feeling as if you need additional support, we did provide some resources here of places that you can go to access physical support as well as emotional mental health support. Please know that at Telement, we are here to support you in your classroom, at your schools, and want to provide as many resources as we absolutely can. So please know that we are here for you. We are a team. We are wanting to support our schools as you do the important work of loving on our kids as they come back into your classrooms. So thank you so much for your time. If you need to contact us, here is our contact information. Please do not hesitate to reach out and let us know how we can continue to support you in the vital work that you're doing in helping our children get back to school.